Come in.
Hi, how are you today?
I'm good. How are you?
I'm doing well, thanks for asking. So my name is Christina. I'm going to be your student nurse, so I'm just going to perform hand hygiene really quickly and put on some gloves and we'll get started, okay?
Okay.
Alright, so can I just get you to verify your first and last name for me?
Paul Heller.
Okay, I'm just going to look at your wristband and then your date of birth.
May 5th, 1999.
Alrighty, and your medical record number.
6959.
Okay, so both of those match your wristband and your chart, so that's good. And then do you have any allergies to medications?
Penicillin.
Any latex allergies?
No.
Tape?
No.
Food?
No.
And environmental?
No.
Okay, alright, so that also matches your chart and your wristband. So now let me just take a look at your vital signs, see what's going on there. So your blood pressure is 120/78, heart rate is at 72, respiratory rate is 18, oxygen saturation is at 99%, and temperature is 98.7 degrees Fahrenheit. So those are all within normal limits, so we're doing good there. So are you having any kind of pain today?
Yeah, my ears are hurting.
Okay, so when did that pain first start?
Like a few months ago.
Okay, and what part of the ear would you say that it hurts? The inner ear, the outer ear?
The inner ear.
Okay, and then how long does the pain normally last?
Like not long, just it's on and off.
Okay, what time of the day would you say it's most prevalent?
No, in the morning and at night.
Okay, and then kind of in between, it's not really, you don't really notice it?
No.
Okay. Would you say it's a dull pain? Is it sharp? Is it stabbing?
It's a sharp, ringing pain.
Okay. And then are there any factors that make that pain worse?
Like high-pitched sounds.
Anything that makes you feel better?
Not that I know of.
Are you taking any treatments or medications for it?
Nope.
And then on a scale of 0 to 10, with 0 being you feel no pain at all to 10 being the worst pain of your life, what would you say your pain is at right now?
Like a 4.
Does it get higher than that in the morning and at night, or does it kind of stay around the 4?
It's more like a 7 at night in the morning.
Okay. Well, the patient doesn't appear to be in any signs of distress. Let me just take a quick look. Both sides of the body do appear to be symmetrical. And then, Mr. Heller, can you tell me what day of the week it is today?
It's a Friday.
And around what time is it?
Like 6 o'clock.
Right. And then where are we right now and why are we here?
I'm in a hospital and my ears are hurting.
Okay. So based on those answers and the fact that he was able to tell me his first and last name and his date of birth earlier, the patient is alert and oriented to person, place, and time. So I know you don't have any equipment, but I'm just going to go over what I would check if you did have any kind of equipment. So if you had oxygen, I would be checking to make sure that there's no kinks in the tubing. I would be making sure that that apparatus is fitting correctly, and that there's no signs of breakdown or any lesions or redness around the place where the tubing is. And then I would be checking to make sure that the oxygen flow rate matched the provider's orders. If you had an IV line, I would be checking again to make sure there's no kinks in the tubing. I would be checking for any tenderness, especially where that tubing was, and for any erythema or edema. And then I would also be checking to make sure that that IV solution that's hanging matched the provider's orders. And then obviously you don't have a urinary catheter, but if you did, I would just assess that accordingly, okay?
Okay.
So now I'm just gonna take a look at your hair. Okay, hair distribution appears to be even, and I'm not seeing any signs of any rashes or lesions. And then your nose. Okay, I don't see, again, any redness or lesions or any odd coloring. And will you open your mouth for me? Okay. I don't see any odd coloring or rashes or lesions of the mouth. Now I'm just going to, you're going to feel a quick pinch on your skin, just checking for skin sugar. So there was no tenting present, and then I'm just going to check your capillary refill. Okay, so capillary refill is less than 3 seconds in both the fingers and the toes, so that is within normal limits. Now I'm just going to check your eyes, so just follow my finger, okay? First I'm going to do this, and follow my finger. Okay, pupils are equal, round, reactive to light and accommodation. And then will you just smile for me with your teeth? Great. So the patient face is symmetrical. Last, I'm just going to check your breath sounds. So are you having any trouble breathing right now?
No.
Okay, so it doesn't appear that the patient is having any trouble breathing and they're not using any kind of accessory muscle use. So will you just turn around for me? And I am gonna lift your shirt up. Okay. So your breath sounds all sounded good. And you don't have an incentive spirometer, but if you did, I would be showing you how to use it and then just having you show me how you would use it just to make sure that you do know how to use it properly. So that does conclude the end of our assessment. Do you have any questions or anything for me? Okay, well, thank you so much, Mr. Heller. I hope you have a great day, okay?
Okay.